Hi, this is Dr. Duresti with the Cranial Release Technique, back with another video. Back in Florida, we came back a little early this summer, and it is cooking here. So if you're planning on coming to Florida, I would wait a little bit, at least another month if you can, maybe 6 weeks or so. But it is what it is. Today's September 1, and if you aren't already back to school, back to work, kind of vacation time's over, this weekend is Labor Day, so it's kind of the last hurrah here in the United States. And I just wanted to do a little review and get everybody's head back into school, back into work, back into thinking a little differently from the summer vacation. So again, let's go back to the beginning. The skull is made of 22 bones, the cranium or the skull. Probably the most important job of those bones is to protect what's underneath, which is the brain, the central nervous system. The central nervous system, according to Gray's Anatomy, the book that we all used in school, is that the brain controls and coordinates every function of the body. So it would only make sense that the most important organ in the body is absolutely covered by bone. A little more than 100 years ago, an American osteopath came along with the idea and said, gee, I wonder why those 22 bones never fuse together. There must be a reason, because nature is perfect, and also structure determines function. So could it be that these bones are designed to move? And that kicked off what is now commonly called cranial work. And there's many different types of cranial work. Many different professions use different variations of cranial work. But today we're going to spend a little more time on the cranial release technique, which is my version of addressing the cranium. So the point of the story is that if these bones, which should be open and aligned, have now closed, twisted, restricted, that will then negatively impact the movement of the cranium of those 22 bones, which will negatively impact the functioning of the brain. And with negatively impacting the function of the brain, anything can go haywire in the body. Things that you're aware of and things that you're not aware of. What do I mean by that? Well, you'll know if you have aches or pains in the body because you can feel it. You can feel if your shoulder's bothering you, if your wrist hurts, if your legs hurt, if your back hurts, if you have a headache. That's one part of the nervous system. But if I asked you, how are the cells in your liver working right now? You probably couldn't tell me that. How's the heart functioning right now? You probably don't, you're not really too aware of that. How well is the brain functioning now? Well, we can only guess. I mean, without some more technical devices to determine how things are functioning. But I'm talking at a cellular level. There's no devices that I'm aware of that can tell you how things are working at a cellular level. But again, the brain is constantly communicating, sending signals out, receiving signals in, to constantly monitor every function of the body, the ones that we're aware of, the ones that we're not aware of. So the job of the cranial release practitioner is to do something to get those bones to open, align, and to get that breathing back. That's what we call the primary respiratory mechanism. Restoring this movement so that your brain will function better and so that you will function better at every level of who you are. I mean, it's a fairly simple concept. It's something that should be done on a regular basis. I have it done virtually every day because my wife is a CRT practitioner. So I work on her and she works on me. Because I have aches and pains? No. Because my body's not functioning right? Not that I'm aware of. But because I want my body to function optimally. Optimal function is what this is all about. So regardless of whether you're struggling with a health challenge, struggling with a digestive issue, a mental, emotional issue, a skin problem, a headache, or whatever, you really owe it to yourself or your family members to get evaluated by someone that understands the cranial release technique. So how do you do that? You go to the website at cranialrelease.com. There's a button there called Find a Practitioner, and you can search practitioners anywhere in the world to see if we have someone in your area and you can get on a table and experience it. The beauty is the technique literally takes about a minute to do. So it's a very simple procedure. It's very gentle, and it takes about a minute. There's no downside to having it done, to trying it out. The flip side is if you're a practitioner, you're out there, you're a chiropractor, you're a dentist, you're a naturopath, you're a massage therapist, you're a holistic practitioner from whatever background, you might want to consider looking into the cranial release technique to add this to your current repertoire of what you're doing with patients on a regular basis. It takes 1 minute to add to a chiropractic adjustment, to add to a massage visit, to add to a dental appointment, to add to a medical procedure. Whatever it is you're doing, everyone under every condition functions better when the cranium is moving and breathing normally. I mean, there's no downside to it. Optimizing function is what this is all about. So if you're a practitioner and you'd like to learn more about how can I add this into my current practice, there's a button on the website, cranialrelease.com. It says online training program, and you can look up and see what the program is that you can learn in the comfort of your home or office. It's a very simple program, very in-depth. I go through every aspect of the cranial release technique so that you will know how to apply the technique, how to do some tests to determine if the technique is necessary, how to explain this to patients. All your questions will be answered on that online training. The follow-up to that, December 2nd, I will be personally leading a live event here in Fort Lauderdale, Florida. And that's called the CRT Mastery Review. And this is only open to existing cranial release technique practitioners. So if you are a practitioner, or if you learn in the next week or two and you want to learn this technique and then come to the event in December, that's great. All the details are on the website. There's a button called Events, and you can search that as well. Again, cranial release technique makes perfect sense. I just came from New York, 80 degrees to 95 degrees here in Florida. My body has to constantly adapt to the change. What's responsible for that? My brain and nervous system. Why do I want to keep this brain and nervous system functioning optimally? Because that makes perfect sense. We want to function optimally most of the time, if not all the time. Why not? If it takes a minute to do, what's the big deal? Visit a practitioner, experience the work, and I hope to see you down the road. This is Dr. Duresti with the Cranial Release Technique. Cranialrelease.com, the website. Look forward to meeting you down the road. Adios, my friends. Welcome to September. Here we go. Have a nice Labor Day weekend. Goodbye.